Hi, I'm Colonel Mike Place, and even though Valentine's Day has passed, let's talk about hearts. Heart health, to be more exact. February is Heart Health Month, and I want to encourage all of you to show your heart a little love. Every year, 1 in 4 deaths in America are caused by heart disease. It's our leading cause of death in men and women. But the good news is that heart disease can often be prevented by making healthy choices in your diet and exercise, as well as other key behaviors like avoiding tobacco. Let's start by focusing on moving and staying active. If you're like me, your days are packed with places to go, people to see, and things to do. Sometimes so much that making it to the gym can be difficult. Or perhaps you're an office worker, sitting in a stationary position behind a computer most of the day. By the time you get home, the comfy recliner can be more enticing than a walk around the neighborhood. Here's a tip to help you pack some movement into your day. Set an alarm on your watch or mobile device to go off every 50 minutes. When the alarm sounds, take a break and get moving for 10 minutes. You can do standing push-ups against your desk, or find a wall and do a few minutes of wall sits. You can even spend a couple of those 10-minute blocks focusing on stretching and do pec stretches in a doorway or standing lunges. You can also take a lap around the building or wherever you work. Even a little activity every hour can improve your mental focus and overall health. Now, on to one of my favorite things, food. For some, the word diet can be scary, but I'm going to suggest you consider the DASH diet. Ranked the #1 diet overall, best diabetes diet, best diet for healthy eating, and best heart healthy diet in this year's U.S. News & World Report. Here's the best thing about it. It's not a diet so much as it is a plan for goal setting. And once you get your body used to it, eating the right foods will become second nature. The DASH diet doesn't require any special food or specific meal plans. Rather, it focuses on daily and weekly nutritional goals, and encourages more fruit, vegetables, and whole grain intake, and consuming fat-free or low-fat dairy products. Take a look at this chart with recommended eating plan goals for a 2,000 calorie diet. When choosing foods for the DASH diet, you'll want to make sure they're low in saturated and trans fats like chicken, salmon, nuts, and olive oil, as opposed to foods high in saturated and trans fats like red meat and full-fat dairy products. You also want to add foods that are rich in potassium like bananas and avocados, magnesium like spinach and whole grains, fiber like raspberry and almonds, and protein like lean turkey or cottage cheese. And finally, choose foods that are lower in sodium. So instead of using ground beef, try ground turkey in your recipe. If you're unable to substitute ground turkey in your meal, use the leanest ground beef possible. Unlike other diets, the DASH diet is pretty empowering. You're not limiting yourself to certain foods. By setting goals to meet your DASH diet servings, you can be creative with food and use meal times as a means to reach your heart health target. If you need some help starting, I highly recommend attending one of our nutrition classes. Call our nutrition clinic or go log on to the Madigan website for more information. Finally, let's talk about tobacco in all its forms. All tobacco products increase the rate of plaque formation in your coronary arteries. In addition, the risk for peripheral arterial disease also increases, not to mention the indirect effects in your body, like the development of pulmonary disease. Quitting smoking is not easy, but if your heart and other parts of your body are more valuable to you than a cigarette, Madigan offers a variety of cessation programs to help you quit for good. Eating right, getting plenty of sleep, and quitting tobacco are ways you can prevent heart disease. If you're ready to make some lifestyle changes to improve your heart health, talk with your primary care provider about next steps. And as always, you can find more information on healthy sleep, activity, and nutrition on our Facebook page. One last thing. At the end of this month, we will be celebrating 25 years of Army medicine here in the new Madigan. I invite you to join us on February 28th at 12 noon in the Medical Mall as we honor former hospital commanders, command sergeants major, and Army medicine, along with JBLM leadership, our special guests, and all of Team Madigan, past and present. If you can't make it, you can watch it live on the Madigan Facebook page. We're excited about it, and above all, remain honored to serve the JBLM military family. Until then, care with compassion.